name is Stephanie Reese. I am a registered nurse, and in the Bachelor's of Science Nursing program, one of our assignments was to complete a portfolio, and I am going to walk you through each tab that I have worked on. We'll start with the first page, which is the home page. It's the Professional Transformation Practice Portfolio. This assignment for this page was specifically to summarize some information about myself, what I've learned, and how I think this course, in addition to all the other things I've learned so far, will contribute to my profession. So I'm going on 3 years of nursing on October 9th. I talk about a little bit how I specifically worked in the cardiovascular step-down unit in a hospital located in the heart of San Antonio, where the population that we cared for was very unique and very broad. I also floated to different units like the telemetry and the neuro step-down, which was also pretty neat because I was able to experience other things and learn. This portfolio reflects my journey from an associate's degree level to the bachelor's degree. Although I am very early on into this program, I already see how much of an impact it would be to my nursing career. So as I advance and complete this program, my goal is to adapt to the information that I have obtained and absorb all that knowledge and put that out into work in the profession I'm in right now as an outpatient cardiology nurse. I look for roles in leadership, ways I'll be able to better help healthcare policy be reformed and make ethical decisions. And so that being said, we're going to go on to the next portion of my portfolio, which is entitled Personal Philosophy Statement. And on this page, you'll see that I've attached my paper, one of the first papers I wrote for this course. And it's pretty self-explanatory. It talks about my original philosophy, thought process as a nurse, and then with the education and part of the class content that was taught in this course allowed me to adjust my thought process and revise that. And so in this paper, you'll see that I'll go into detail about how the foundation I thought of nursing kind of grew and evolved into more ethical aspects and different ways that can better help my nursing degree. For an example, I just talked about how the information that was taught in the class helped my critical thinking. It reminded me and reaffirmed that patient advocacy is very, very important, specifically to each patient and their own cases as far as their disease processes and the resources available to them in hospital and outside of a hospital. So this paper is very interesting. It took a minute for me to kind of fully grasp that and kind of reread certain areas to make sure that I understood what it was talking about as far as the leadership and growing in the profession. And so this was a pretty neat project. And at the bottom, I did tie in a reference because I did reference the American Association of College of Nursing in that reflection portion. And so we'll move forward on to the next topic here, and we're going to go with the ethical dilemma case study. Actually, I'm so sorry. We're going to go with the legal and professional standards. So in this paper, or this section of the assignment, that I was tasked with expanding on legal statutes and professional standards. And so it was very intriguing to the aspect of understanding and comprehending how legal standards benefit the patient and the nurse as a whole. It's very important that we uphold the framework that's laid out for us and use that correctly to benefit the patient. And so this paper was pretty neat, to kind of go in and dig a little deeper into understanding the Texas Nurse Practice Act and understanding the ANA Code of Ethics and how it's structured to provide us a guideline in which to follow, and it would allow us to still practice safe, quality nursing care. And so this was a pretty neat topic also. I'd say this one was probably the one I spent a lot of time on, grasping all the information. The next one we will go to will be the ethical dilemma case study. This ethical dilemma case study hit very close to home. I'm a cardiology nurse and work outpatient, so I really poured myself into writing this short paper and just talking about how I realize more so things in this degree level is beyond the bedside care, is understanding the different types of issues that patients have to face when inpatient and even getting discharged from the hospital. And with this specific one, it was in regards to patients receiving heart transplants and just the workup that's needed and everything that goes into account for the selection of those who are granted that allocation of the heart. And so I found information a little alarming to see that the caveat here is the racial disparity that is seen throughout patients of color versus those of a different race. And so the end result of this was just understanding that the people in place to make the decisions of how and who and when a patient is able to receive a transplant truly affects the outcome of the patient on the other hand. And as much as we want it to be unbiased, many times, and it's proven in this article, that it still happens. And so I have a really good understanding now of how my responsibility as a nurse to identify these situations before the patient is put in a position to have a negative outcome. And so just having justice for all patients in general. So this is a very neat paper, and I am very happy with the outcome of that. And so now we're going to move forward and go to the health policy brief. And this paper, this assignment, was focusing more on policy within the state of Texas and how that can affect patients. And again, I made it my own and kind of lined it up with what I practice now in my nursing profession, which is, again, cardiovascular outpatient. And this paper talks about just overall how telehealth access has grown, has gotten a lot better, but still has some improvement. And unfortunately, telehealth access became a lot bigger and widely used during the COVID-19 pandemic. And so that in itself, I feel like didn't allow it to develop as well as it should have, because obviously priorities were in different areas when a time of need and confusion were there for a lot of healthcare workers. And so this paper talks about how nurses can still advocate for a patient, but in a way where we engage ourselves in policy reform and understanding policy of the hospital or policies within the state and, the federal level, and understanding how that directly affects a patient and their outcome, as far as the access they have to high-speed internet, the access they have to be able to be seen when they have transportation barriers or other barriers that would prevent them from going out in public. Like that, during that time of COVID-19, it was frowned upon to go outside during a quarantine time. And so with that telehealth being available, it's very beneficial for patients. And unfortunately, there's a lot of areas that don't have the electrical components that help patients have the high-speed internet or reliable service that would help them. And so cardiac patients need close monitoring. And so having an insight to how I can make a difference and contribute advocacy for my patients in regards to policy change is something that I profoundly am interested in now. And I am learning how else can I make a difference for these patients. And again, I wrote it specifically to cardiovascular, but just to all patients in general. So this was also a very neat topic, very fulfilling, very mind-opening to see how things can improve and how it can benefit the patient to have that same care via telehealth. And so I'll leave this here for you guys. The last thing I do want to talk about here is my professional identity reflection. So although I'm very early on into this BSN program, the transition from the Associates of Nursing to the Bachelor's has been a wonderful experience so far. I'm being challenged in all aspects of my critical thinking and how to advance myself in this profession. So I am so far happy with this program. I feel like I have a lot of support in being provided the tools that are needed to better my leadership skills, to improve my critical thinking, and to lead me in the right direction on how to advocate for my patient on all aspects. And my original philosophy still stands. I still believe in the reflection, perseverance, commitment, accountability. But I feel like it's grown more because now I value the things that are being taught as far as like evidence-based practice, continuous learning, because we know that healthcare is ever changing and there's always a need to keep up to par. And so the experiences I have encountered with this program and with my profession from transitioning inpatient to outpatient, all specifically in cardiology, I have seen some growth and am understanding my professional identity and how I can commit to my patients to provide that quality care. And so I plan to pursue other endeavors once I finish this, continue in the cardiology aspect of it, but specialty certifications that can better help me understand patients' leadership roles to help me help nurses who are new and oncoming, like I once was, and kind of give them that extra support that they need. And then to me, the most important is advocating for the patients, and being able to be efficient and effective in all aspects of my nursing profession so that patients' outcome is positive. And so I feel like towards the end of this program, I will be more equipped to make a positive impact and directly serve the community in a way that is beneficial. And so here you have it. The next final page would be the reference page. So I did put in the references here, and this is all the sightings I have for anything that I talked about in my papers and in each slide. And so you have that there. And then in the presentation video, obviously when I'm done with this recording, I will go ahead and upload that and put that on there so it'll be a direct link. Overall, I am happy with this course, and I feel like the title in itself speaks to what I have learned, transforming myself to become a highly equipped registered nurse.